Welcome back to Good Day Stateline. Dr. Kapoor and Joe Agnello are joining us this morning from Transitions Hospice. We're going to talk about traumatic grief. So you are going to explain, Dr. Kapoor, what that actually means.
Yes. So a person, when they're going through losing a loved one, there's going to be a portion of that experience that is traumatic. There's going to be a shock, a numbing feeling. For those of us who have experienced that, that experience shuts off the emotional part of your brain so that, you feel somewhat powerless and helpless in that moment. And it's almost like the fight or flight response becomes triggered and you're frozen. So that dictates the type of response that we should have to those individuals who have just lost somebody, which usually is dictated by really just being there for them and being present for them.
So, Joe, tell us a little bit about how we can identify trauma and or PTSD.
Well, PTSD is often associated with soldiers, with combat veterans, because that's when the phrase got coined by Bessel van der Kolk back in the 60s. He started working on it. By the 1980s, that was a diagnosis. And we identify it because a person who's in PTSD is hypervigilant. They sit in the corner of the room. They don't want anybody behind them. They can't sleep at night. They're nervous. They have these thoughts that just intrude, no matter what they're doing, just intrude into their consciousness. And that's what happens to a person who has PTSD. Now, I can tell some beautiful stories about having worked with veterans because I've worked with over 2,000 of them in my whole life, not in a week, but over a lifetime. And honestly, what our patients and their families go through is something very similar. I asked them, were you there when your loved one died? Yes, I saw him. I was powerless. I couldn't help him. And I watched my father dying. I've watched my wife losing consciousness. And they go berserk as they're telling me. But here's what's happening when they're telling me that. I'm sitting right there with them. I'm comforting them with my voice and with my touch, not words. Actually, when they're recounting the story, they can't even think clear. So I don't use words. I don't try to talk to them, counsel them, advise them, or preach to them. So what I do is nonverbal. And by giving them comfort as they're reliving the experience of their trauma, actually they pull through. They modify their experience. It's as amazing as that. So I look for the signs and the symptoms. But the reason the trauma that they're experiencing, traumatic grief, is different from PTSD. Having someone shooting at you and throwing grenades at you and, firing mortar at you is very different from watching a one-time event of watching your loved one die. And PTSD is long-term. It lasts a long time. In fact, last month, we had a veteran who was a Marine in Vietnam. And when his wife died, he went berserk. He threw chairs up against the wall. He broke mirrors. He punched doors and walls. And he had an episode that he was out of control. Well, what's the natural reaction when you're around a person who's out of control? You want to run away from him. You don't want to help him. You want to get away from a guy like that. Well, he served in Vietnam 50 years ago, but he has been undiagnosed, untreated all these years. So I'll have to tell you the name later. But this gentleman went to the hospital and they calmed him down, and then they started doing some counseling with him, and that's something that should have been happening all along.
Sure.
So for me, when I see a family member who I see signs of traumatic grief. This morning I got a call from a lady who I originally called her in October. She never called me back until this morning, just before my getting in the car to come here. And she said she was doing okay because she was with family. She went to live with her daughter for a month. She had things to do. She had business to finish up with documents and insurance. So she's been busy. What she was doing, she was avoiding her grief. She was setting it aside by keeping busy. But it hit her today. She's sitting in her house all alone, no kids with her, nothing to do, and she's crying, and she picked up my card and she called me. I told her I had to come here, but I told her I'll call her tonight.
Oh, good. We're glad you're going to call her tonight because she could definitely use your help. If anyone wants to find more information about Transitions Hospice, where can we go?
Transitionshospice.com, and you're going to get the most amazing hospice experience that I have seen. So,
perfect. We'll go right there. Thank you. We have one more session with Dr. Kapoor and Joe for you next month. We're going to talk about good grief. But next on GDS, we're getting caffeinated at Meg's Daily Grind, and later showing you an incredible machine that's helping patients recover from anxiety and depression without medication. We'll be right back.